Hi everyone. This video is to debate the topic of telehealth technology and its threats to the future of special education and ABA. We will be debating this topic in an informal debate style to present the pros and cons of the topic at hand. I will now take the time to introduce myself and group members and the roles that we will have throughout this debate. My name is Sabrine. I live in the Chicagoland area and I am the introducer in the debate. Brooke, who's in black, she lives in Milwaukee, Wisconsin, and she will be the summarizer. Lindsay, who's in red and lives in Portland, Indiana, will be the illustrator throughout our debate and will be presenting on the various graphs and visuals that will come across throughout this debate topic. Patricia, who's in cream and lives in Lansdale, Pennsylvania, will be the fielder, and she will host the Q&A that we will have at the end of our debate. All members serve as researchers and have contributed to the research of our debate topics, and we will all present on the pros and cons of the various topics of our debate. Before beginning, I will provide a definition of what telehealth is for the purpose of our debate. According to Tomlinson, telehealth is defined as the use of telecommunications and information technology to provide access to health or behavioral health assessment, diagnosis, intervention, consultation, supervision, education, and information across distance. Now to begin, Patricia will start on presenting on the convenience of services within telehealth.
Thank you, Sabrine. So as she discussed, I will be talking about the pros for convenience of services. So in 2016, Luxton et al. Reported that telehealth was becoming more widely accepted in clinical practices due to increased convenience, decreased stigma, improved patient outcomes, and reduced expenses. Since then, telehealth has rapidly expanded and become more integrated within the implementation of applied behavioral analysis services for those on the autism spectrum. Due to its easy accessibility, telehealth provides families from rural and isolated communities the ability to gain access to highly trained behavior analysts and improved continuation of services and follow-up care. This aspect of telehealth helps BCBAs avoid running into ethical dilemmas for Code 1.11 multiple relationships. Not only does it provide easy access, but it also allows BCBAs to observe their clients in a natural setting. With the easy accessibility of telehealth, behavior analysts can increase their supervision and communication with clients and caregivers. This will allow them to make timely adjustments to treatment plans and intervention, which in turn could help accelerate progress. Through telehealth, BCBAs can better provide a variety of services to clients, including assessments, implementation of behavior plans, parent education and training, ABA programming, and supervision and monitoring programs for those seeking continuing education at the undergraduate and graduate levels. Another benefit of telehealth services is the cost effectiveness compared to traditional methods.
Thank you, Patricia, for sharing. To sum up, telehealth provides a large geographical reach, more opportunities for BCBAs to observe in a naturalistic setting, an improved patient outcome, and a wide variety of services being able to be offered, as well as it being cost effective. Up next, we will hear from Sabrine and Patricia on the pros and cons of the financial factors of telehealth.
Thank you, Brooke. To begin on the pros of financial factors in telehealth, I will start by explaining the economic and political climate of our nation. So given the current economic and political climate of our nation, financial factors are an important consideration to look at. According to AAA gas prices, our nation's average cost of gas per gallon is $4.98. The price hike can create a huge financial burden on therapists commuting, especially for in-home therapy, and even more so for therapists who commute from home to home in rural areas. According to a literature review of training individuals to implement ABA procedures via telehealth, telehealth training served as a financial savings and relief for both organizations and therapists. This could also be due to the fact that therapists are not always reimbursed for the materials that they purchase, such as toys or other materials that they would require to run programs in their session. So, when providing telehealth services, it could serve as a financial relief for the therapist to no longer need to feel the need to purchase any materials to engage their client in session.
So, cons for financial factors. Although telehealth may present as a more convenient option, it is not accessible to families and therapists who fall into a lower socioeconomic status. According to Tomlinson, in a literature review discussing implementing ABA in telehealth, the basic equipment required to participate includes a computer, microphone, and webcam. In an article titled Acceptance of Telehealth Therapy to Replace In-Person Therapy for Autism Treatment During COVID-19 Pandemic and Assessment of Patient Variables, a financial burden to telehealth identified is technology access. Unless provided by the company offering services, purchasing these high-cost items is not within most families' financial means, and therapists may also struggle to offer services if they fall responsible to purchasing their own equipment. Along with these three items, another critical element required is having a strong connection to Wi-Fi. This can also present as a struggle to many families and therapists. Lastly, in-home therapy services typically include a therapist bringing in several items or materials across homes to run certain programs and engage clients in sessions. Without therapists coming to the home, the responsibility of providing most of the materials will fall upon the families, creating yet again another financial burden that could hinder the quality of services required for their overall ability to participate via telehealth in general.
Thank you, Trish and Sabrine. To sum up, a pro for financial factors are lower travel costs and the fact that not all companies reimburse RBTs for materials such as toys. Having those resources at home could be beneficial. And that a con for financial factors is telehealth. For telehealth is access to technology and Wi-Fi, and families in a low socioeconomic status may not be able to afford those things. And finally, families would be forced to purchase certain materials, and it would be an added expense. Up next, we will hear about quality of services, a pro and con from myself and Lindsay.
The quality of services that you are receiving via telehealth is important. Gutierrez et al. Said, with good feedback, quality improvements can be made to benefit people using telehealth. Telehealth has shown to decrease problem behaviors in children through the use of functional communication training that comes from Lindgren et al. It has also been found to increase desired behaviors in children. The main benefit to having telehealth online is that it follows the BACB ethical code, and that means that we have to be within compliance, which I will discuss. I'm going to present a figure from the Lindgren et al. Article. This article shows the study, design, and implementation of functional communication training. Please wait while I share my screen. The figure shown displays the randomized controlled trial design and implementation of functional communication training. So you can see how the ASD diagnosis was confirmed here, and then they completed an FA with the social function, randomized to intermediate functional communication groups, behavior assessed weekly during the first 12 weeks of FCT treatment, and then the functional treatment completed through using telehealth. Randomized to delayed functional communication groups, behavior was assessed monthly during the 12 weeks of functional communication delay. Delayed FCT treatment started functional communication not needed, and the child responded to extinction and monthly behavior probes during delayed period. And as a result, the delayed functional communication treatment was completed. The Ethical Code 2.03 states that the behavior analysts arrange for efficient and appropriate consultation with clients and families. That comes from Bailey and Birch, 2016. It means that if the quality of services that is implemented is not good or efficient or appropriate for clients and families, then that is in violation of the ethics code and can result in losing clients or losing a license or ability to practice. Benefits of having the services online, as I stated, is not having to drive, and that can also affect if the quality of services are not great, then they can affect the client and waste the time of everyone involved.
In regards to the con for quality of services, in the wake of the COVID-19 pandemic, healthcare providers have been forced to look for additional ways of providing services to their clients. Telehealth offers an easily accessible way of doing this. While there are many benefits of implementing services through telehealth, there are also other cons. The practitioner's scope of competence, attitude, and biases towards using telehealth technologies, such as the hardware, the software, and the internet, can impact the quality of services being delivered. Not having the proper training or understanding of software technologies and clinical implementation could compromise treatment integrity, deter interest in using telehealth technologies, and cause potential harm to clients. Pearson McDonald, 2022, collected and categorized a comparison list of deterrents identified by over 28,000 licensed practitioners. This information will be provided in Table 2, which Lindsay will present after this point. The authors found that practitioners are less likely to engage with telehealth services due to a lack of training, concerns with ensuring the safety of clients during crises, protecting the privacy of clients, the considerations of ethical issues, and being unsure of the effectiveness of the treatment when not conducted in person. BCBAs must be confident with their understanding and transfer of ABA services to telehealth to ensure that they comply with Ethical Code 1.05 and practice within the scope of competency. It should not be assumed that skills enforced during in-person treatment can be easily transferred to the telehealth setting. Practitioners need to take the time to assess the appropriateness of telehealth services for each client. To sum up our points, for a pro, it can be quality of services are essential. It can be shown to decrease problem behaviors in children through just one example, the use of functional communication training, and it correlates with Ethical Code 2.03. As for the cons, Pearson McDonald collected and categorized a comparison list of deterrents. Clients are less likely to engage with telehealth services due to a lack of training. There are concerns with ensuring the safety of clients, protecting the privacy of clients, considerations regarding ethical issues, and being unsure of the effectiveness of treatment when not conducted in person. Now, Lindsay will present Table 2 from the Pierce et al. Article.
Thank you, Brooke. Please wait while I share my screen. The Pearson et al. Article that is displayed is the final list of deterrents. So you see the code and then the description of that code. So, for example, the first one is client safety / crisis concerns. There's expression of worry for remote clients who may be in crisis, or at risk of harm. The costs, the concerns for the time of financial costs associated with implementing and maintaining telepsychology. If you look down further, you will see that the ethics statements questioning the ethicality of telepsychology. If you look down further, you will see things like legality, preference, preparing, planning, and privacy. All things that also are important in this section and the descriptions that follows.
Thank you for sharing, Lindsay. Up next, we will hear about privacy and HIPAA compliant software from Patricia and myself.
Thank you. So we'll start with pros for HIPAA compliance. It is essential to have secure connections when working via telehealth to ensure that there is no breach in HIPAA compliance. Lee et al. Examined 6 different telehealth providers who are considered to follow telehealth compliant regulations. These include Skype for Business, UpDocs, VC, Zoom, Doxy.me, and Google Hang. Telehealth.hhs.gov has also provided examples for professionals of ways to best conduct telehealth services for clients with disabilities. First, it is important to ensure clients have access to session materials prior to scheduling appointments, ensuring accessibility for those participating, and providing interpreter services if needed. During the appointment, practitioners need to make sure that the telehealth platform is accessible, such as having interpreters on call prior to bringing in clients, having captions readily available to read, and providing high contrast. Likewise, be sure to confirm patient's identity, avoid public Wi-Fi, and use virtual private networks. Finally, it is also best practice to use headphones to avoid revealing information to individuals who are not qualified to listen.
I will now be discussing the con of privacy. So while working with clients via telehealth, there is potential for privacy breaches in regard to their right to control their protected health information, or PHI. According to Cohen et al. 2020, PHI is defined as any identifiable information that may relate to the individual's past, present, or future medical conditions. This identifiable information includes, but is not limited to, name, social security number, address, and photographs of said individual. This is where we run into the issue of privacy within telehealth. Families have the right to examine and obtain health records, and if the only form of contact is via telehealth, the ability to receive those health records via a screen share or email may be impeded due to Wi-Fi issues, not being on a private network, or other individuals listening in. Oftentimes, BCBAs are conducting telehealth in their own home. This increases the risk of family members or other individuals possibly listening in and hearing this private health information. This possibility for privacy breach violates BACB Ethical Code 2.06, maintaining confidentiality. Code 2.06 states that behavior analysts have an obligation to take reasonable precautions to protect the confidentiality of those whom they work for, established by law. There is no question that there is high potential for breaches of privacy if the only form of communication is via telehealth or another website, such as email or in a cloud form of document. That is not HIPAA compliant, or if BCBAs are conducting telehealth sessions in a public setting or where people are around. To sum up both of our points, a pro for HIPAA compliant software is when working with it, you must have secure connections when on telehealth. We have identified several sites that are HIPAA compliant, and according to the Lindgren et al. Article, studies have shown that there are secure ways to use telehealth without divulging certain client-sensitive information. As for the con, there runs the risk of privacy breaches for private health information. Families need access to forms and documents, and telehealth is not always the most reliable. And finally, BCBAs or other clinical professionals that are doing telehealth in a public setting are not appropriate.
And now I will share the ethical visual and explain the crosswalk. And this will wrap up all the codes that we have presented for this section. So please wait while I share my screen. The summary of the specific BACB and APA ethical guidelines related to health services delivery and associated examples that facilitate or raise potential ethical concerns. So you will see that it displays the ethical code, the ethical guideline themes, the implementations, and associated telehealth models and steps that should be taken. So, for example, the first code, BACB 1.02 and APA 2.01, states that boundaries of competence, therapist's skills needed to conduct procedures effectively, and then choosing a service delivery model in the last section. Again, in the next section, BACB 1.05, professional and scientific relationships, building rapport, remotely attending to social cues from caregivers, and initial meeting and evaluation procedures. These codes are all things that are very important when dealing with telehealth, and we liked how this was summed up in this section, and that it gave a good representation of the codes that are all needed to follow when implementing telehealth, and how if you violate these codes, then you could risk losing your license or losing your client. Next, I will share with you the crosswalk for behavior analysts, which can be found on the BACB website. This article that we found is the crosswalk for behavior analysts ethics codes. It describes how the codes have changed and where they are now that the codes have changed. So, for example, the professional ethical compliance for behavior analysts that was effective in 2016, and the ethics code for behavior analysts, which was effective in 2022. You have 1.0, responsible conduct of behavior analysts. The statement is the introduction. Or you have the boundaries of competence. 1.02 is now practicing within scope of competence. 1.05. I will scroll down and I will briefly go through some of these and how they are important and how some of them do relate to telehealth. So when looking at these, you can find that consultation, 2.03, collaborating with colleagues, consulting with other providers is very important, even if you're doing it via telehealth. You have things like third-party involvement in services. That is now collaborating with colleagues, 2.10. Third-party contracts or services, 3.07. The responsibility to the client with the third-party contracts or services, 3.08. And communicating with stakeholders about third-party contracted services, 3.09. You also have maintaining confidentiality. This can be known as protecting confidential information, 2.03. 2.04, disclosing confidential information. 2.11, obtaining informed consent. And 5.11, using digital content and public statements. This document has a lot about the different codes and things and how they apply now. But those are just some of them and how they can relate to telehealth.
So that concludes the points that we will present on our debate for the pros and cons. We were able to cover the convenience of services and the pros that provides within telehealth, the pros and cons of financial factors in telehealth, the quality of services, and the privacy and HIPAA compliance software used in telehealth. Now to begin the Q&A, Trish will host some questions to our members.
Thank you, Sabrine. So my first question to the group is, how has ABA telehealth services impacted you in your profession?
Yeah, so I can touch base on this. So my company, we are continuing to do telehealth services both with families and while overlapping clients and supporting technicians. So even though COVID is sometimes it's spiking, sometimes it's decreasing, we've kind of maintained this telehealth service providing. So I really have seen the benefits and detriments when it has come to telehealth. Prior to the COVID-19 pandemic, we were all in person, as many of us probably were, and really had little to no telehealth experience. But at the beginning and sort of during that peak of COVID in 2021, staff were able to support families with certain goals, work on some skills, obviously depending on their foundational skills, and train parents and guardians on many different tasks. It also helps with the maintenance of skills, so some of those skills aren't lost. Likewise, it really does protect a typically vulnerable population from any form of illness, whether that's COVID or the flu during those major flu seasons. However, on the other hand, I have seen some of the cons. It is difficult to work with a client if the client doesn't have those foundational skills. Like they cannot attend to a tablet. They find interest with technology, as many of our clients do. If there are Wi-Fi discrepancies, or truly if the family's not willing to work with us. A lot of families do work. It's just the nature of this job, and they just that we're kind of on the back burner for that. So I have really truly seen that as a difficulty when conducting telehealth services. To kind of sum this up, though, I do believe that telehealth can be beneficial for certain clients and families, so that there is no loss of skills. So we can maintain those skills even when there are illnesses with staff or students or things like that. However, I don't believe that it is for everyone.
Great. Thank you, Brooke. My second question for the group is, what are BCBA's ethical responsibilities in regard to this topic, and how do these impact practice?
Okay, so as BCBAs, we all are required to follow the BACB ethical codes and guidelines. One guideline that first and foremost directly applies to everything in terms of following telehealth is a topic Brooke already touched on a little bit, which is the BACB guideline 2.01, accepting clients. When choosing to accept clients, behavior analysts have to consider their personal education, training, and resources available, both for themselves and the client. So not all clients, clients would qualify for telehealth services just in terms of their foundational skills of attention, ability to use the technology, or anything like that. So it is a consideration that BCBAs would have to take in when accepting clients in general through this platform. Another BACB guideline and ethical code is 1.05, and this deals with multiple relationships. As BCBAs, we are not allowed to have multiple relationships with the families that we work with. So accessing telehealth actually provides a great solution for families who live in rural areas to be able to access BCBAs that they do not have multiple relationships with. And then lastly, the last point that I kind of wanted to touch on is the guideline 2.05, rights of clients. So the BCBAs need to be careful not to risk the family's confidentiality and privacy when using telehealth. Throughout the debate, we talked a little bit about the pros and cons of privacy in telehealth. And one thing that we talked about was the increased risk of breach of confidentiality and that. So it is definitely a consideration, and there needs to be the proper platforms and streaming services put in place when using telehealth and ABA to make sure that we're following all of those ethical guidelines.
Great response. Thank you, Sabrine. All right. And then last question for the group. How have the recent world events associated with COVID-19 pandemic impacted this topic?
Thank you, Trish. So when we all started COVID, some of us did go telehealth. I personally didn't go telehealth because I was inexperienced in the field of ABA at the time. But as Brooke previously discussed, some of us did. So when COVID struck, some of the clinics closed. We had to go online. We couldn't do in-person services due to the risk of possible exposure. So that definitely impacted telehealth. It was used more frequently, and some of the pros to telehealth were exposed, you could say, and then some of the negatives to it, or the kinks, you could also say, were also exposed. So that became evident in the light. I also think that with COVID-19 and telehealth, some things became easier and then some things became harder. It could be harder to deal with maladaptive behaviors. It could also be harder to teach a child certain hands-on skills, but it could also be used to, as previously stated, decrease some problem behaviors, but also used to help in other ways where that telehealth can be used to benefit. And when we did go telehealth, if you look at some doctor's offices, it can be hard to go to a doctor and get a blood test done via telehealth. You have to actually go in and get that done. And that can be the same thing with ABA. Some things are, again, hands-on, and you can't do them over the phone, but some you can.
Great. Thank you, Lindsay, for your response.
Okay. That concludes the field portion of our debate and the Q&A. Thank you so much for the questions, Patricia, and everyone for your answers. And this concludes our overall debate. And just as a last illustration from Lindsay, she will go ahead now and show our reference list to end our debate. And I just wanted to thank everyone so much for taking the time to listen and hear the pros and cons that we presented.
Thank you, Sabrine, and everyone who shared. I will take a second and share my screen and share our references. So these are the references we used when doing our research or putting them in our outline as such. Thank you for attending our presentation.